Hi, I'm Kristin Osborn, and I'm here today to share with you what I know about working with the defenses. And my hope is that after this webinar, you're going to feel much more comfortable working with defenses and have a better understanding of how to do it. So to begin with, if you need more information about defenses, I have a lot of webinars that I've posted on YouTube that you can go to, and they really dive into defenses in a way that could be very helpful to you. Because when working with defenses, you want to be remembering that you're looking at how to help your client recognize their defenses, how to help them look at the cost and benefits of the defenses, how to build motivation for them to let go of defenses, and then essentially how to let go of defenses. And so all my webinars really speak to the nuances of this type of work. You also want to go to my website, www.affectphobiatherapy.com, where you can find so many different resources available to you that can help you in your clinical practice. And to begin with, I just want to show you what I have used to learn about defenses and help you understand how it shaped my practice over time. And so I learned how to work with the APT model through the ATOS scale, which was developed by Lee McCullough, and it was developed specifically for the APT model. And with the ATOS scale, if you are video recording your sessions, basically you want to be wondering inside yourself, like, what affect is my client running away from? Are they running away from anger, assertion, sadness, grief, closeness, tenderness, positive feelings of the self, sexual feelings, enjoyment, interest, excitement, healthy fear? The list goes on. There are a lot of different affects that are out there, and people will have avoidant reactions toward an affect that they don't feel comfortable with. But with the ATOS, you'll notice the first thing that we look at is insight or awareness into maladaptive patterns, thoughts, feelings, or behaviors. And what we mean by that is, how aware is your client to their maladaptive patterns overall? Are they aware of defensive thoughts? Are they aware of defensive feelings? Are they aware of defensive behaviors? And so, you know, when you're working as a therapist, you want to really be paying attention to, how aware is my client of their defenses? And most people who come into therapy are not terribly aware of their defenses. They know that they have problems. They know that their problems are contributing to their pain and suffering, and they know that that's why they're there to see you. But they're not actually so aware of what it is that they're doing that's creating so much pain and suffering in their lives. And what your job is as a therapist is to help them increase their awareness so that they can actually take a step back and realize, oh, that defensive thinking or that defensive feeling or that defensive behavior is really creating problems for me. Can I do it differently? And of course, in therapy, you'll be teaching people how to do it differently. Okay? So another thing with defenses is, like, how motivated is your client to give up their defenses? And what I mean by that is, how uncomfortable are with their defenses? And if they're not so uncomfortable, can you, through therapy, be able to help them really be able to identify what's working for them and what isn't working for them? So the ATOS scale, if you are video recording your psychotherapy sessions, could be extremely helpful to you. But even if you're not, you want to be using the ATOS scale as you look at your sessions and try to figure out, like, how aware is your client of their defensive thoughts, feelings, and behaviors, and how motivated are they to let them go? So another scale that can work for you, and again, this you can find on the www.affectphobiatherapy.com page, and it's listed under research, and then you can find it under research scales. And this is the ATOS therapist. And this is a wonderful tool for you to just be checking up on yourself. It's one thing to be paying attention to your patient and how well they are doing in the therapy session, but what about paying attention to you and how well you are doing? And so again, if you're video recording a session, you want to have a moment to take a look at you and see how you are reacting in the face of maladaptive patterns of thoughts, feelings, and behaviors. And most importantly, are you communicating what you see to your patient? So with the ATOS therapist, we are again identifying what affect the patient is moving away from, and that's our focus. And then we're paying attention to how well are you at seeing the defensive thought, feeling, or behavior and communicating it to your patient? Because if you're not seeing it, we need to help you learn how to see it. And if you are seeing it, but you're not saying anything, we need to help you learn how to say something about it. And if you are able to see it and say something about it, then we need to help you be able to work with what happens next after you point out a defense. And a lot of times what happens next is your patient actually begins to feel quite anxious, and you might be able to see some defensive behaviors come to play, because it's not easy having someone point out your defense. And if you're not in your own therapy or surrounded by a peer group where people are willing to speak up to you and tell you what they see in you as defensive behavior, I urge you to go out of your way to make that happen. Because the best way to figure out what's happening for a patient when you're pointing out a defense is for you to be able to experience it in your own life through your own therapy or your peer supervision group or with your friends. Another thing that you need to be paying attention to is how are you helping your patient increase their motivation to give up their maladaptive patterns? And so, you know, are you able to explore cost and benefits with them? Are you able to explore grief that comes up when looking at defenses? So, you know, just keep in mind that your job as a therapist when working with defenses is to point them out gently, right? And then to also point out, you know, what the cost and benefits are, and to begin to help your patient understand that there's healthier ways to respond. And one way is through actually experiencing the affect that they're running away from so that they can relieve the anxiety and the defenses that are related with that affect. And again, I talk more about that in my other webinars. The next form that you need to be aware of is the triangle form. And this is good for both patients and clinicians. And basically, you can use the patient triangle form in order to really help you and your patient look at what affects they have access to and what affects they're running away from. And if you identify an affect that they're running away from, let's say they're running away from anger, then you want to identify the inhibitory affect that is causing them to pull away from the adaptive affect, and that is usually a form of anxiety. And so in the face of anger, they feel anxious and they pull back from anger, and when that anxiety gets too uncomfortable, they activate a defense, which once that defense is activated, it really cuts off their capacity to be connected with themselves, to connect it with others, connect it with you, and connect it to all the feelings that they have inside. And so one thing that's really wonderful about APT is that we work in collaboration with our clients. And so we're working together to help our clients see their defenses, to understand how they're running away from an adaptive affect. And we begin to start doing what's a core conflict formulation with our client. Because you always want to keep in mind that a defense is activated in childhood, where it really works for the client, and what happens is that it continues to play out in the current life, and at a certain point the defense no longer works. And you'll see defenses come out in the therapeutic session, and it's pretty easy to see that that defense cuts off connection with your client with their connection with you, and also with their ability to access their feelings. And so with the triangle form, we actually encourage patients to use the triangle form. They can always have a Xerox copy that they keep floating around, and they can just begin to practice at identifying what affects they're running away from, how they're running away from, and what defenses are being activated. And you can use that in your own practice too, so that you can get a real sense of, you know, what affects are you running away from? What affects are you comfortable working with? So, so all of these forms, as well as the webinars and the website, are going to be extremely helpful to you when looking at how to melt defenses. So, just as a reminder, this is what a triangle conflict looks like, and the idea is that instead of someone experiencing and expressing their adaptive feeling and having access to all the beautiful behaviors that are connected with it, they pull back, and when they pull back with anxiety or fear or shame or emotional pain, and it becomes too uncomfortable, they move into a defense. And once that defense is activated, then they're completely cut off from themselves, cut off from you, and cut off from their feelings. And so, you know, what happens when you are working with defenses is that you'll actually see the activation of anxiety and defenses happen in session. And so, you know, you want to start off with by asking your client to describe a specific example that demonstrates the problem that they've come to therapy for. And you want to carefully listen, watch, and pay attention to even your own instincts as they describe that specific example. More often than not, you'll see anxiety rise, and then you'll see defenses get activated. And so when that happens, you want to be able to see the signals of anxiety if they're observable, and then to see what defenses arrive in the room. And so, you know, while you're doing that, you're actually using the triangle of conflict, and it's perfectly okay to be writing this down on your notepad. And you're noticing, okay, in this example, it looked like my client was close to experiencing sadness, but instead of experiencing sadness, she pulled back and she ran away by being guarded and self-protective. And so, you know, you just want to be writing down what you're noticing, what you're observing, because once you get a hang of what's happening, you're going to be talking about this with your clients so that they can see what it is that they're doing. They can see what feeling they're running away from, how they're running away from that feeling, and then what defenses are being activated. So it's always important to be listening, watching, and paying attention even to your own instincts as your patient describes a specific example. And you notice I had a little bit of a Freudian slip there when I said that they were running away from their family, and I really meant to say their feeling. But that's the truth, is that a lot of our defenses are constructed in childhood, and they're constructed in order to block access to a specific affect that wasn't accepted by our family or by the traumatic situation that they're in. And so essentially, while someone's running away from a feeling, they're also running away from the family in some way too. And so it was a nice slip that really helps us understand that running away from feeling a lot of times is running away from family. And so as an APT therapist, you're really always paying attention to the psychodynamics, meaning you're always paying attention to where someone blocked a specific emotion, and trying to understand why that happened and who they were with. And so the triangle person is a very important piece of this. And so you want to always be curious about the origin and maintenance of the defense. How old was your client when the defenses were activated? Why were the defenses activated and with whom? Who reinforced the defenses? Who reinforces them today? Who challenges them or offers a different experience? And more importantly, how is it playing out in session? Because when someone is avoiding a specific affect or avoiding connection with themselves or you're going to see the anxiety rise, you're going to see the defenses activated. And what you're going to be doing is jumping right in and working with it. And usually that means regulating anxiety, helping someone melt defenses, and then moving toward the affect that they're running away from. So, with defense restructuring, it's really important that you're able to identify defenses and that you're able to identify them out loud to your client in a way that is warm and comforting and really helps them be able to take in your observations. And so it's not easy to be on the other side of mirroring, and that's why I encourage you to do your own therapy and to be with your peer group and with friends who offer you mirroring. It's good for you to know what are your defenses, what affects are you running away from, because it helps you be much more compassionate with your client when you're working with them. And compassion doesn't mean easy. Compassion means sometimes forceful, direct, strong, warm, contained. It really depends on who your client is and how you're going to work with their defenses. There's some people that if you're warm and fuzzy and soft, that they'll just disrespect you and not really have any motivation to join you on this journey of working with their defenses. They might need you to be more direct, straightforward, to point things out like 1, 2, 3 in a rational, logical fashion. And so it's always important that you're paying attention to your patient and thinking about what's the best way to deliver this information. How do I mirror back the defenses in session that's going to work for my patient? Some people need you to be soft and warm. Some people need you to be straightforward. You need to be able to figure out what's going to work. So what I find extremely helpful is helping someone be able to identify if their defenses have been hurtful or helpful, and always, always, always looking for the origin and maintenance of the maladaptive defense. And I really strongly recommend that you read Bruce Perry's work and George Vaillant's work if you want to understand this more, because they're both so expert at understanding the origin and maintenance of defenses. And the more you understand about defenses, the easier it is to work with them. And another thing is just never forgetting your role as coach, is that you want to help your clients understand what life would look like if they weren't defended. What would it be like for them to be in relationships and to feel calm and contained and safe and warm, and to realize that even when anger comes up, that it's an opportunity to work through problems, and through working through, they can actually feel closer to themselves and others. And another thing is that you always want to be working on your ability to regulate anxiety and to be ready for those emerging emotions that come up once someone does relinquish the defense, they let go of their anxiety, and they're ready to move toward feeling their adaptive affect. So if you need any help with understanding a little bit more about this, again, I strongly recommend the Treating Affect Phobia manual and Bruce Perry's work and George Vaillant's work. And so thank you so much for joining me today, and I hope this is helpful in helping you understand how to compassionately melt defenses, and I look forward to seeing you at my next webinar. Thank you.